Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
Good Monday morning, everyone. I'm Martina Bills. Thanks for joining us here on the WSAZ Now desk for Journey Through Parenthood. Today, we are talking about women's health after they've had a baby, their postpartum health. We talked to Dr. Stephen Brumfield, a OBGYN at Valley Health, a few weeks ago about how to prepare your body for pregnancy. And then we talked to him about prenatal health for while you are pregnant, and today we're talking about postpartum health for actually when you have that baby, how to get yourself feeling good in a timely manner, healthfully.
The first and foremost thing we want to do is to make sure they're not having some complication that's going to pose a danger to them. So we really try to educate the nurses in the hospital and the postpartum unit, really try to educate folks on things to watch out for. And so paying, you want to just get out of there and go home, but paying good attention to that education, really stress as a very, very important part of that. Knowing things to look for which you should seek evaluation or care, the warning signs, as we call it. Once you get home, hydration, good nutrition, as we've talked about, getting rest when you can, which is very difficult with a newborn, especially extra difficult if you've got other young children at home. But those things are helpful, and asking for help when you need it. And then the other thing I would say is keep your postpartum appointments. Sometimes that's difficult, again, with young kids to care for, and especially if it's difficult to get someone to watch the kids while you come to an appointment. But we often find things that could potentially pose a danger to the mom at those visits. Mental health, of course, is a big thing as well. And if you feel like you're suffering in that regard, always reach out to somebody and get care. There's lots of things we can do about that. And there's a lot of detrimental effects, even on the newborn, not only the mom, but certainly on the new mom, the newborn, and other children in the family with postpartum depression and these problems.
And I know that I feel like in the last decade, even just since I had my child, postpartum mental health has become something that is more talked about, which is only a positive thing going forward.
Sure, absolutely. Yeah, and there's even some unique therapies. We tended to use the tried and true antidepressant medications when something like postpartum depression does come up. The typical medicines like Prozac and Zoloft and Celexa and some of these. But there's now some treatments that are specific for postpartum depression that are really exciting, and they work much more quickly and work very, very well.
Dr. Brumfield, how important is it for a woman to realize after they have had their child, to realize that this process should be slow going? Because I know that social media plays a role in that, and everyone wants to, get back to how they were, when the reality is, the baby cooked in that belly for 9 months, and it's not going to happen overnight. And healthfully, it's probably not a good idea to happen overnight, or to think it should happen overnight.
That's correct. That's absolutely correct. Yes, it's a really dynamic time in the postpartum period for a woman's body, is the changes, the transitions that they're going through, the stresses on the body, particularly in moms that are hopefully breastfeeding. That is another nutritional drain on the mom. And so, yeah, taking your time, focusing on things like rest, as difficult as that may be, nutrition, hydration. These things are really, really vital to the postpartum recovery.
So a lot of good information from Dr. Stephen Brumfield, and a lot of it may sound like common sense, but for a woman who just had a baby, there are hormones, there are body changes, there's a lot going on, sleepless nights, a lot of newness that comes with having a newborn, whether you've had one or multiples. And Dr. Brumfield says that just really keep in tune with your body, with your mental health, just because that mental health and can really affect a child too, that baby, if it's not, if you're struggling mentally. So also, he said that the changes and stresses that a woman come to their body over those 9 months of carrying a child really needs time for healing, and those changes, someone's not going to just bounce back. And I know social media plays a big role in that, thinking that, you know, you should look the same, your figure should look the same as it was before you had a baby. And really it's all about time and healing and making sure you're as healthy for you and the baby and any other children in your household as possible. So Dr. Stephen Brumfield, a doctor with Valley Health and OBGYN, a lot of good information, and we will post this to our website. And if you want to see the rest of the segments with Dr. Brumfield that I've done, or any other Journey Through Parenthood, you can go to WSAZ.com and just click on that Journey Through Parenthood tab, or you can reach out to me on social media. And if you have a story idea, feel free to pass it along. We hope you have a great start to the week.